is Marie-Annick Le Pogam. I'm a public health physician, and I work at the Center for Primary Care and Public Health, which is in Lausanne. It's a university center, and we have half clinicians and half researchers, and we all teach. My field of research is about reusing secondary data, and with my colleague who will present herself, we're trying to push towards integration of AI in public health, because we think that we really need that for global health and public health, and we try to develop a little bit on that within our presentation. And we are also very happy to have invited four speakers who will present actual example of use of AI in public health, as we really think that it's very nice to create AIs doing things locally, but it's better to have AI doing things for the populations and being really implemented in the real life.
Thank you. So Valérie Pittet, I'm also working at the Center for Primary Care and Public Health Department, Epidemiology and Health Systems in Lausanne. My background is in technical science and epidemiology, so I'm not a medical training. And we will go with this session together. So we propose that we start with the first presentation, which is a review of public health and the interesting point applying AI in this area.
Yeah, and relating to the questions, well, we have quite long presentations. It's 20-minute presentation each time. There are 4 of them. And so we don't have much time for questions. And so maybe we will take one question after each presentation, and if you have some more questions afterwards, maybe you can discuss with the speakers at the lunchtime or within this room at the end. So, starting with our presentation, before addressing the limitations and challenges of AI in public health or global health, I will briefly recall 2 or 3 definitions. The previous presentations try to talk about what is public health and global health, but with a medical point of view and a public health point of view, we want just to recall a few things, and then we will propose few examples. There are several examples, not many, but several, and then we will have some challenges, summary of challenges, and also some few perspectives. So, in this presentation and in the field of public health, we consistently refer to health as the one defined by the WHO Constitution. And this is the definition for health in public health: the state of complete physical, mental, and social well-being, and not merely the absence of diseases or infirmity. This have implication for AI. In public health, we don't need tools for improving clinical care. We need them, of course, but we need more than that. Public health is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts of society. And Winslow, an English, very well-known English public health professional, completed this with not only society, but public and private organization, communities, and individuals. So it's a major concern for the entire people. Just again, to pose some definition, medical model, healthcare model, is not the public health model. It's complementary. These models are complementary, but public health models is much larger than the medical model. The medical model is usually individual-centric. It's focusing on treating patients once at a time, while the public health model adopts a population approach, aiming to improve health outcomes for the community or at the societal level. Medicine primarily focus on treatment of diseases once they have occurred, while public health emphasizes diseases and promoting health before the onset of disease. It's more than preventing than treating. The medical model operates with a biomedical framework, meaning it focuses on biological factors, and AI in the medical domains is focusing on biological factors mainly. There is no extensive consideration of social determinants of health. In contrast, the public health model uses socio-ecological perspectives that considers a wide range of factors affecting well-being and health. Finally, the medical model is a key component of the healthcare delivery system. It's focusing on clinical services, while the public health model encompasses a broad range of systems, including policymaking, public education, and environmental health. That's what we expect AI do for public health, addressing these different sectors. Here, a view of the global health challenges that we wish AI will address once. First, the public health systems worldwide have to address rapid responses to health threats, such like pandemics or outbreaks. See the COVID-19 experience, which was a very good example of public and global health threat. Managing and preventing chronic diseases, heart diseases, diabetes, cancer, which are the major cause of death currently. Addressing health inequities, meaning disparities in health access and outcomes in different populations. Responding to environmental hazards such as pollution and climate change. And there have been great sessions on climate change addressed by AI during the conference. Dealing with the increasing demand of health services with more and more limited resources, increasing prevalence of mental health issues and lack of access to mental health care, the rise of superbugs resistant to current antibiotic, and globalization. And more, well, this is not the entire global health challenges, but only some of them. Global health challenges also include inequalities in health coverage, generalized malnutrition, obesity, and also starving, and increased humanitarian needs and migration due to hunger, home conflict, political violence, or environmental hazards. So that's quite a lot, and this is not all of the challenges. Yet we expect also to have AI work on these different topics as public health physicians, of course, or public health professionals. So to adapt to these global challenges and to globalization, and in the light of the 2030 Sustainable Goal developments adopted by all the United Nations members, sorry for my English, United Nations members in 2015, the WHO and the World Association of Public Health, World Federation, developed the Global Charter for the Public's Health. And this charter is a framework, comprehensive framework, that can be applied globally, but also within individual countries, whether low, middle, or high-income countries. And this framework has already been adopted in several countries. It's really been implemented, whether in high-income or low-income countries. Thus, the charter, according to this charter, public health consists of 3 core services: protection, prevention, and promotion, and a group of 4 enabler functions: governance, advocacy, capacity, and information. And of course, you see why I cite this, because information is totally related to our topic of interest, which is AI. So, protection, what is it? It's safeguarding the public's health against external threats. Promotion is encouraging activities that facilitate healthy living and well-being at the socio-ecological level. And prevention is assessing health risk and developing or applying intervention to halt disease progression. Regarding this charter, what is expecting as an information? The health system are expected to provide innovative surveillance and monitoring system for populations, effective evaluation of public health programs, to create national health information system with innovative and reliable data, to develop research and evidence on inequalities, health determinants, patterns, interventions, policy, identify potential health risks, and develop innovative solutions to mitigate them, and to also appropriately disseminate strategies to facilitate knowledge uptake by the policymakers, the healthcare providers, and the public, meaning the public health stakeholders. So now, my colleague will present few examples of real implementation of public health surveillance and monitoring.
Yes, thank you. So I will show you now some examples of application of AI in different main domain of public health. So the first is public health surveillance and monitoring. You probably also, if you were in the last session, heard about that. So the application of AI methods on traditional but also new sources of data may provide opportunity to allow for better surveillance of infectious diseases epidemics, but also on any other non-communicable health condition like diabetes, for example, or suicide attempts that needs to be monitored over time. And AI-powered approaches may provide information that can be collected, processed, and analyzed for building real-time digital surveillance systems. So now I selected for each domain some publications. Of course, it's just a selection of publications to show about examples that were published in scientific papers. So the first is about real-time digital surveillance of vaping-induced pulmonary diseases, for example. So you maybe you already know this health map platform that was built based on a new kind of information, for example, that comes from news aggregators, but also using data from validated official alerts. And the people that develop this platform use all this data classified by disease. So there are some health conditions that can be accessible over the world, depending on location and time, where some alerts could also be shown depending on the information available over time. And they use this platform also to collect information more specifically on vaping-induced pulmonary diseases in the US, with differences that could be observed by region, and showing also over time a very an increase of the number of cases of pulmonary diseases linked to this vaping material. The second is about using other types of data and analysis. So it's about drug overdose mortality surveillance. And in this case, they use NLP analysis of free text information that are present on death certificates, which show that it was very interesting to make a surveillance of drug overdose mortality. And what is interesting in that case is that it can be done very quickly as compared to the use of traditional methods that usually we need to have several weeks working on death certificates to be sure we have the information that could be used and validated further. The next domain is about health promotion. So in this case, we could also use AI method, for example, for try to identify target populations or locations with high-risk profiles for implementing specific health promotion interventions. It can also help to optimize health communication by profiles, and finally also to individualize risk assessment. So you can use AI method to search for individualizing this risk assessment and approaches to answer some unmet needs. Again, as an example, so I have only one publication that I took here, which is a review about intelligence-based chatbots used for promoting health behavior changes. And so it reports interesting results on the efficacy, but also on feasibility, safety, which is not so much discussed, acceptability and usability of these chatbots. And as an example, the main papers in the review were on the promotion of healthy lifestyles, so targeted on physical activities, healthy diet, measure of blood pressure or BMI over time. There are other applications about smoking cessations with, for example, some paper that could show that, in fact, smoking cessation was 2 times higher by using the chatbots, but in the short term. So it's not so evident in the long term, but that in the short term it was shown that it has an advantage. Other examples are, for example, in a reduction of problematic substance use, like drugs or alcohol, and they show an increase in the confidence to resist to urges to use the substances by using these chatbots. And the last one was about medication adherence. Again, in this area, it could be shown that in some studies, adherence rate improved by more than 20%, but again, it was in a short time for the moment, only 4 weeks. The next domain is about disease prevention. And here AI could help for implementation of screening programs and also help to identify high risks populations for preventive interventions. Here, a very interesting paper that was published very recently about the screening on hepatitis C. And in this paper, so the author developed a model based on the retrospective data, and they performed a prospective study with AI screening, and they show that they get an extrapolated number needed to screen of 10, and they compare this result with people when they look to people eligible to screening according to the guidelines over the same period of time. The number needed of screen was almost 100 more, which is really very interesting first results. Other application of AI might be to use the massive amount of data that are produced and generated by public health surveillance program and also healthcare delivery systems for example, implementing strategies for screening, but also for deciding some specific preventive measures in the case of women with cardiovascular diseases over women's lifespan. The next is about emergency preparedness and response, which is also a big domain in public health. And in this domain, AI methods could help, for example, in detection and tracking of emergency signals. It can be related to disasters, mass population moving, also to help optimize resource allocation and services organization. And finally, they could also help deriving predictive models of emergency department workload So you may have also some application that use AI that can, for example, give you the information where you better have to go if you have an emergency problem, because there are some departments which are really busy as compared to others. Or the need for very specific care, like critical care. And if I go to on the critical care side, so this is one example using artificial intelligence algorithm to predict the need for critical care in a pre-hospital emergency medical service. So they could show that indeed this algorithm could give a good prediction, but for the moment it's only prediction, it's not something that is implemented further. There is also examples of trying to use chatbots, for example, in emergency medical services, but it was not so good. In fact, here there is only critics. For example, there are false statements that are given by the chatbot, or there are false indication if you look to very specific clinical recommendations. And the last one is using a little bit different kind of information. So it uses automatic speech recognition for detecting stroke. And this algorithm shows an increase in stroke detection, for example, for about 10%. Thus, that lead to a rise of thrombolysis by 5% in stroke patients that could be treated at that time. And it's particularly interesting for different kind of population, for example, for females, young patients with stroke, or the calls that are taken during the weekend, for example. It's not the last. The next is about health protection. So here I could use in making some prediction of health issues due to environmental threats and also surveillance of at-risk population. I go quick on this. So only one example, for example, if you can use image processing for public health surveillance of tobacco point of sale advertising. So in this example, they use image recognition to see if in the point of sale, if there are some advertisement regarding tobacco that respect the recommendation or not. So it might be also interesting to integrate this in public health intervention. For example, for young people, are they really in front of the advertisement that they should not normally be? And the last one is health assessment. So in this case, we could use AI for identification of population subgroups in specific needs, and also prediction of incidence, prevalence of events related to health planning purposes. Here, I just put some example about predictive models. So usually, you find a lot of prediction that goes well with AI model, but again, it's still only on the side of prediction, but it's not on the side of implementation. So the prediction is usually good, but it's only prediction. And the last example is about interesting example, detection of hypoglycemia in people with diabetes that are driving cars because they are at risk of accident. So by using some other kind of data like sensor, etc., you can get very interesting results in order to try to implement something to avoid accidents. Yeah.
So, well, I don't want to take time from the other speakers, so just very quickly. We've done this review with my colleague, and several points, several challenges have emerged for AI in global and public health. I will go very quickly because I don't really have time to develop, but there is indeed a lack of implementation. The focus is much on a precision medicine approach and not the public health model, as I mentioned at the beginning. There are concerns, and serious ones, about privacy, interpretability, and bias of AI in public health. The problem with interpretability and transparency is that it may hinder the trust and the usability by policymakers or patients or healthcare professionals of AI in public health. And also there is mistrust currently, probably, probably, I don't know, but maybe unjustified, but there is mistrust and resistance to change, and it's always the same in the healthcare professional sphere. It's very difficult to implement changes, and there are, of course, implementation science which improves that, but it's still difficult. And you probably know that it takes about 17 years to change the practices in healthcare. And well, we expect that it goes faster as AI is going very fast. There is a regulatory pace. AI is going very fast, and the regulation is going quite slow. And it's currently difficult to implement AI in public health at a populational level when you don't have the entire regulation ready to frame it. Also, there are some legal complexity in AI liability, and who are responsible currently about AI policies, well, AI-based public health policies or AI-based programs, public health programs implemented at a populational level, and there is no answer currently. Also, there are limitations of AI in addressing the health workforce crisis. Of course, AI can help planning the workforce, but at the same time, a great amount of the budgets are going to AI development, which is very great, but not to the workforce, and this has to be considered. How can we help the workforce enter the public health and the healthcare sector without impending it with, budgets going to somewhere else, in particular to technology? And also, because of bias, we might have some risk of reinforcing inequities or disparities in healthcare outcomes instead of improving health at the populational level. There are risks of it's the former presentation. We have some more and more vulnerabilities to failures and cyber threats, because we are depending more and more about AI, and it will be the case in public health too. The data requirements are very huge, and AI requires validated data with high amounts of it and with good quality. They need to be standardized, and in most cases at a global level, we don't still have this data. There are big financial implications about investments, about management, about data storage, about updating healthcare systems, health information systems. So these financial implications are not really considered at the time. And we still have a lot of research gaps. This could be nice that you work on that, on AI effectiveness in public health and also AI efficiency. Just to conclude, a few reflections about non, ça c'est une ancienne version de la présentation. Perspective of AI in public health. AI surely has the potential to enhance public and global health, but there is need to develop AI tools targeting public health and not medicine. There is need to transdisciplinary and international collaborations, and what we've seen so far is, unfortunately, there are silos. The tech is working on its side, and the public health is working on its side, and barely doesn't understand anything about AI. So there is a need to improve AI literacy in the public health sector, but there is also a need to consider that we are professionals of public health in the tech sector, and that collaborating would be better than presenting very nice tools that doesn't work in the real life, but because you know, the advantages and limitations, and the field ground is not really known. And, well, this is for us a big problem at the moment. Collaborative and long-term policies and strategy should be created that prioritize ethical and legal standards. Also, to building and maintaining trust, which is very important for change in the real life, there should be clear, understandable communication, transparency, and engagement with the community. So AI tech has to train and educate the population alongside the public health stakeholders, ensuring equity and fairness, of course, to reduce the inequalities. And at the moment, the LLMs are built on lots of knowledge from the US or English-speaking countries. And where are the low and middle-income countries in the data for training the models? Research and evidence on AI effectiveness and efficiency is really necessary. And also, well, this is my public health point of view, the ecological burden of AI needs to be addressed and mitigated.